Good morning and welcome everyone to the public session of the Oversight and Engagement Board for the 5th of November. I'll come straight. Welcome everyone who's watching live and welcome to everyone who's attending. I'll come straight to the next item, which is the minutes from the previous meeting, which was the 29th of October 2020. I'm looking around the room. If anyone's got any queries on those minutes, it would appear not. If you have, please do feel free to email them to us, but we'll accept those and sign those off as read.
It's just the attendees and the apologies. There's some duplication again. That's the only thing I've picked up.
Oh, okay. Thank you. Perfect. Thank you, Lucy. So we'll come then to the next item, which is national lockdown, and that's Lucy Whiteman, our Director of Public Health. Hi, Lucy.
Good morning, everybody. So as everybody will be aware, today is the first day of the national lockdown, which is going to be lasting approximately 4 weeks. Obviously, we've had some information about what that entails, but I do recognise that there are some queries still about what is or isn't permitted. So we're working hard to be able to clarify some of those gaps that do exist. But broadly, most businesses have been informed if they're able to remain open, but it is essential shops only. And even within some of those essential shops, some sections will potentially be cordoned off, so that people are obviously only able to access essentials over this period of lockdown. There is going to be a notification process for the clinically extremely vulnerable, and they will be notified if they haven't already in the next couple of days, and guidance given about additional measures that they should be taking over this period to protect themselves, and guidance to their support bubble or their immediate family, again, as to how to protect themselves over this period. But we won't see the same level of shielding that we did in the first instance. Anybody who does need to access any support to isolate, either because they are identified as clinically extremely vulnerable or because indeed they're an identified case or a contact of a case, there is support and information available on the Northamptonshire County Council website, both about emotional support if you're feeling socially isolated or have any concerns about your mental well-being, but also physical support in the form of food packages, pharmaceutical deliveries, etc. So please do be aware that there is support available. From a point of view of testing, it's just making sure that people are aware that obviously testing is going to continue to be key throughout this lockdown period. And although we recognise that people will broadly not be mixing or indeed be going out at all because of the lockdown, they still may develop symptoms, particularly in the first sort of 14 days. And we know the incubation period on average for the virus is 14 days. So anybody who's got any significant concern, any symptoms, or is identified as a potential contact of a case, they must still seek testing, and all of our testing sites remain open throughout this lockdown period. You are still able to access home testing kits as well, and travelling to and from a testing site is indeed one of the journeys that you are able to make under the lockdown circumstances. So please, we encourage people to continue to access those facilities. This is going to be key to us understanding during this pause period where the virus is, and as we did before in Northamptonshire, to get back on top of that onward transmission. I want to take this opportunity as well to remind people, if they do test positive during this period, they must isolate away from other members of their household. So, you know, yes, we recognise that that is a challenge for some people, and we do recognise that all households have shared spaces. But if indeed possible, if that person can isolate away from the rest of their household and utilise those shared spaces last, so sort of have a rota for kitchen use, recognise you can't necessarily go to bathroom use, but making sure that we obviously always clean down afterwards. It's just a dilute bleach solution that is the best barrier from a point of view of cleaning to COVID. So some really simple hand washing, face mask wearing and cleaning routines can really help reduce the transmission within the household during this period as well. From a point of view of NHS services, I think the other thing that's really important to communicate is that our NHS services remain open. So if you do have any concerns, obviously you have your general practitioner and 111 for immediate advice. But obviously if you are invited to a routine screening or a planned event through an NHS provider, all of those remain in place unless you are identified and contacted separately. So please do keep all of those appointments that you've got. It's imperative that, you know, we keep utilising those systems and services while they're still there. We're obviously hoping that this lockdown will bring down the demand, the COVID-related demand on our NHS services, and help retain the capacity that we do have for those really important planned events, operations and diagnostic services. So please do keep those appointments and make sure that you get the attention that you need over this period. I'm happy to take any questions, but I think obviously most people are aware of the current position, and the government, as I said, continues to publish guidance about the exact details of what isn't allowed. But yeah, please happy to take any questions.
Thank you very much, Lucy. I think we're all aware of the national lockdown, obviously, and the rules that go with that. It'll be interesting to see how it goes. I'm going to I haven't got any questions. The only thing anecdotally was I know someone who is shielding, or was shielding previously, who has indeed received a text message already in the last couple of days from the health service to continue their shielding. So that is already happening. I'm going to come straight on to the local surveillance data and back to Lucy for a summary of that. Thanks, Lucy.
Thank you. So we're just going to share the slides. Again, this is information that's available and updated weekly on the Northamptonshire County Council website. So this is the publicly available report, and this provides a position up to the 25th of October for the whole of Northamptonshire. And in that week up to the 25th of October, I'm sad to say that Northamptonshire actually saw its first week with over 1,000 cases. It obviously is a key sort of milestone in our journey with COVID, and it's not something that I'm pleased to report, and it clearly demonstrates that there's more that we all need to be doing to help reduce the onward spread and transmission of this virus. Obviously this was published pre-lockdown announcement, so do recognise that as always we're saying that we need to follow national guidance, and therefore there are links through the report to that. If we go to the first page. So we obviously pre-lockdown remained in tier 1. What we're keen to do is to try and use this 4-week period to obviously reduce our viral level in the community, to reduce the burden on our local NHS services, and to come out of lockdown in an even better position. So obviously at the moment the tiers themselves have been removed and everybody is in the same position of lockdown, but what I think is really key here is people recognising the opportunity for us to take action to reduce the viral spread and to come out in a position that's even better than the one that we went in. If we move on, we go down to the data page. As I said, a lot of the guidance has now been sort of superseded by the national measures. So here's the position. So over 8,000 cases cumulatively now, which is really quite a shocking number, but more worrying than that is over 1,000 cases in 1 week. As I've said before, we now see more cases in a day than we were seeing in a week in September, and that trend clearly isn't really slowing. The other thing, if we go down to the next slide, that's clear is we've still got a challenge across all of our age groups. Yes, 10 to 19 and 20 to 29-year-olds continue to be the largest age group with positive cases, but that surge in the 40 to 49-year-olds here is quite significant. And again, we've still got more females testing positive than males. Is still more likely to do with their health-seeking behaviour. So again, I encourage any gentleman out there who may be concerned, may be having symptoms, or be identified as a close contact to get tested. Anybody who isn't getting tested, if they have any suspicion of symptoms, or if they've been told that they are a contact of a case, is potentially putting their loved ones at the wider population at risk. If we move down. All boroughs and districts here are affected. We've had a small decrease in the number of cases from last week in Kettering, but the number of cases in the week up to the 25th of October remains above 100. So big numbers here that we're still talking about really across the piece. If we go down to the next slide, that shows the rates, so we can compare areas. And again, here we've got in Northampton 168.3 cases per 100,000 as a 7-day average. Really close behind that, you can see Wellingborough. So, this is not something that is just unique to our more densely populated areas. Our more rural areas, such as South Northamptonshire and East Northamptonshire, also still having case rates above 100 cases per 100,000. So a really concerning picture across the area. All boroughs and districts now have more than 100 cases per 100,000 as a 7-day average. If we move down, this just shows the increase for each of the borough and districts from a graphical perspective. So again, you can see that increase over time. The worrying thing for me, as I've said before, is the fact that, particularly for places like Northampton and Wellingborough, you can see the gap between the England average rate and those two local borough and district average rates reducing, which means that they are increasing in their case numbers at a more rapid rate than the England average. So we do not want to be catching up with some of our neighbours, either in the East Midlands or further north. This is a concerning picture. Clearly, it fluctuates week to week, but the overall trend is still significantly upwards. We move on. So the school position and university position, it is becoming more challenging over time. We've now got 26 active outbreaks in schools and colleges, and you'll see that with 185 cases associated with those 26 outbreaks, that you've got quite big numbers associated with each individual outbreak. University has reported 22 cases in the previous week. Again, those won't all be present on campus. They are registered students at Northampton University, so they could be resident elsewhere, either in the county or outside, but it is attributed to the university itself. And that is, I should say it's students and staff as well. So again, it doesn't necessarily reflect the number of students in halls. And I know that there's been a lot of coverage and concern about that. The University of Northampton is still in a very positive position, and we work actively with them. In fact, the local testing centre that has been on the Market Square in Northampton will be moving to the university car parks in the next week. It's piloting this week to make sure it's ready to roll. And then the Market Square will be closing to make way for Christmas tree. It does mean that the University of Northampton is able to host on a longer term basis that testing site. So we're very grateful for them having that there. It is walking distance again from the Market Square and for most people within the town centre, so that's good news. It also has significant parking, which is free again, so that's good news for people who do need to attend that site. Pleased to report that 99% of schools remained open in the week up to the 20th. Obviously that was prior to half term. 91% of pupils were attending at that point, as compared to 94% at the same point the previous academic year. Now, clearly that's going to correlate with the number of cases associated with schools and colleges, as I've said before, and each school takes a slightly different approach to how they obviously cohort their staff and students, and also their tolerance level for remaining open. But we work closely with them in the Department for Department for Education to make sure that we're in contact and providing consistent advice to those settings. We move down. So again, as always, we provide just an update of the crude numbers and where they are in the last 28 days by community. So you can see some of the areas that are affected. I'm sure people will be able to see that that is a significant spread across the county. As I've said before, this is no longer an issue that is contained within our more densely populated or more deprived areas. It is a Northamptonshire-wide challenge. If we move down 2 further slides, that just gives us further information about the geography and the impact. So if we stop on this one just quickly, this is a relatively new slide. We've only had it in a couple of weeks, but what we're trying to show here is the rate of change in different wards. Obviously this is as a case rate, so it's making each area comparable, but you can see the most rapid increase in the darker blue areas. And again, although some areas in Northampton clearly a focus because of the density of the population, you can see South Northants, Kettering and Wellingborough all featuring in that top 15 list. If we go down again, from a point of view of outbreaks, we continue to have quite a challenging picture. So the last couple of weeks, we've seen a significant increase in the number of outbreaks that we're managing locally. And again, correlated with that, you can see that rather large number of cases. Now, these are not new outbreaks. It's not 78 new outbreaks since last week. They stay active as a status with Public Health England and ourselves for 28 days after the last case was identified. So they can stay on the record for quite some time. But what is clear is that they are across a number of different settings and across all boroughs and districts. Again, you would expect to see more outbreaks in Northampton because it is more densely populated. We have more businesses, we have more schools, we have more care homes there. But it is clear that this is a challenge across the piece. Lots of different settings are involved. And more recently as well, we've had more hospital and hospice-based outbreaks, largely due to the fact that we continue to do the proactive swabbing of staff and patients. So it's helping us make sure that those are safe environments. We swab in a different way. We do it proactively, even when people don't have symptoms. So it's nothing to be alarmed about. It is absolutely a process to make sure that we identify COVID early, that we isolate patients and staff to protect the ongoing provision of services, particularly as demand because of COVID increases over time. So if we move on. We started to include just a bit of an update around flu vaccination as well. Obviously over winter, this is a significant pressure on the NHS as well. So we want to make sure that people who are eligible for vaccination, and it is a much wider cohort of the population, almost half of the Northamptonshire residents are now eligible for a flu vaccination. We wanted to make sure that we provide people with an update and obviously continue to make sure that this is at the forefront of people's minds. If they are invited for a flu vaccination, they please must go and have one. At the moment, the numbers look reasonable, I think is the only word I can use. We still have a long way to go, but it is early days. The flu campaign only starts around October time and runs all the way through into the new year. The one thing I would recommend is that particularly pregnant women and children, the uptake needs to be improved. They are vulnerable from a point of view if they have reduced immunity. Obviously, a pregnant lady themselves may not have reduced immunity, but their newborn baby will have. And young children do have reduced immunity overall. The one thing they're also very good at is catching something, it not affecting them particularly badly. And we've seen this obviously with COVID, but it's the same with flu, but they're very, very good at passing it on to members of their family. So again, it helps overall immunity across all ages within the population. If we can get our younger people vaccinated, they don't end up being a sort of reservoir of germs, which sadly they can be. Love them as we do. So please, particularly while we're locked down, if you are locked down with other members of your family, particularly if they're vulnerable and you get that invitation for a flu vaccination, those services are still running. Please do go and get that vaccination. The rest of the pack, as always, just has updates and information about the campaigns that we're running and the work that we're doing. So I'll stop there and see if there are any questions. Councillor Morris.
Thank you very much, Lucy, as always. A great run through the local figures. I'm looking around the room. Yeah, Toby Sanders. Hi, Toby.
Hello, Ian. Hi, thank you, Chair. And a comment rather than a question, if I may, just to add to the information Lucy shared in terms of current position across the county to provide an NHS perspective to that. We'll have all listened over the last few days nationally to the case for the current national lockdown measures being very much about protecting and avoiding the NHS becoming overwhelmed, particularly in terms of hospital capacity. As we are here today having this conversation, our latest data shows that we're continuing to see increases in the number of COVID positive patients who are in our two acute hospitals in Kettering and Northampton. The numbers as of yesterday's report standing at 88 across the two acute hospital sites. And as members of this meeting will be familiar, that's been pretty much doubling over the last couple of weeks, fortnight by fortnight as we've gone along. We know that the national measures are all about helping to slow the rate of increase in community cases, which is going to be really important to helping get this back under control. But from an NHS perspective, we also know that the time lag of 10 days or so between cases translating into acute hospital pressures mean we are still braced for those numbers of acute admissions to carry on increasing. And to put it into context, those numbers, whilst they remain in overall terms relatively small across our overall bed base, we've not seen that level of inpatient hospital admissions since all the way back in early June of this year. Two important things therefore sit alongside that, and these might sound like slightly contradictory messages, but both are true at the same time. The first thing to say, and to emphasise Lucy's point, we really are encouraging and urging people to continue accessing normal NHS services where they need them. It is so important that people who've got concerns, that people might have appointments, that they're coming in that way, to make sure that they're still making use and accessing those services, because the NHS is still open, is here, and is here to support people. The second point, though, which is equally important, is really just to urge people to do everything they can to make this lockdown count. Regardless of our personal feelings of how we might have got into this period, we do have a 4-week period now in front of us where we can do something to really help to bend the curve on this and to really help to get back into a better place. And we know that if we carry on seeing those levels of emissions increasing, the risk that we run is the NHS getting to a point where we can't provide some of the elective and routine surgery that we want to carry on being able to do. We've not quite reached that point at the moment, but we're not far off, Chair, in terms of where we might need that conversation locally. So really, there's something we can all do across the county to help to try and avoid getting into that place during the next few weeks. Thank you.
Thank you very much, Toby. Some sobering thoughts there, and we all concur with everything that you've said there. David Jones.
Thank you, and supporting everything that's being done. Obviously, we're all in a very different situation, but from a Health Watch perspective, our job is to give the public response, or to ensure that people are getting feedback. And obviously, in this very different environment, how we do that has to change. And I'm just saying to Toby and Lucy and other colleagues in managing the health service, we are currently starting a review of how Health Watch operates. We're not able to visit sites, we're not able to see for ourselves what is going on, but the public still needs that assurance. And so we're very open to having discussions about how we can effectively give the public assurance and see that things are working well. So we're very open to having a conversation about that, and I will be in touch with colleagues, Joe as well at Kettering. And perhaps just to say, if I may, some good news. 2 of our volunteers at Kettering received a national award for the work that they've done with Kettering Hospital to do the 15 steps, looking at how hospitals are working. And we've got to find new ways of doing that, but congratulations to them for that award. And thanks to Kettering for cooperation.
Thank you, David. That's really quite heartening news that people are being rewarded for their hard work. And we must always thank all the people involved with all these services for all the hard work they're doing constantly during this pandemic. I'm going to move on now to testing update from Sharon Wright. Hello, Sharon. Good morning. It is still morning. Yes, it is. There you are. Good morning, Sharon.
Good morning, everybody. I think Lucy's covered a lot of the testing update in hers, but just to reiterate, all our testing sites are open. We have got 4 testing sites operational, plus our regional testing site in Kettering, and we still have 2 MTUs rotating around the county. We did have to move very quickly from our testing site in Stratton because the site it was on just got a bit soggy and it was a bit slippy. So we had to close it very quickly and move it onto the university site because it was easier to just get it moved onto there very, very quickly. So it shouldn't have caused any problems. But I think we just need to reiterate that, and the comms team are going to put this in the briefing, is people should not take from the information that is on the sites about where the testing sites are and just turn up for those reasons, because sometimes we do have to close quite quickly and the appointment system will be updated immediately. So we really just need to reiterate that people do need to go to the online portal to book an appointment, because that is where the most updated information will be about which sites are open and which sites are closed. The university local testing site is in the process of being built at the moment, and that should be completed today, with piloting going on over the next couple of days, and then we should be in a situation to see it go live on Sunday, is the plan. So hopefully that will all go to plan, and as Lucy said, it will sit on the university site for the foreseeable future. We are looking at other innovative ways of testing. So nationally, there will be some new ways of being tested coming down the line, including being able to be tested at your GP surgery. So you go there and your GP thinks that you may have COVID. So we'll see some of that coming online in the next over this next week or so. So we will keep people updated through the comms on the NCC website of how all those progress and how to access them. Thank you.
Thank you, Sharon, and thank you to you and your team for the sterling work that you're doing in keeping the testing going for the county. It really is probably a very difficult job, I should imagine. I've got a couple of questions. I've got Councillor Phil Bignell, and then I think David Jones may have had his hand up from before, but I know he's taken it down. So it's Phil Bignell. Over to you, sir.
Yes, thank you, Chair. A question for Sharon. The test site at the university, is that in addition to the rest, or does it replace one of the existing sites?
It replaces the one on the Market Square in Northampton, because so that the Christmas tree can go up.
Lovely, thank you. Now,
but we do run a lease. So the license for any site is for 3 months. So you do have the option at the end of 3 months to say that you don't want it anymore. Most of our sites have gone on for a second 3 months. So, but in light of Christmas, and we did have a site already backed up, so it was an easy move to do.
Thank you. Now.
Thank you very much, Sharon. I just wanted to quickly ask you about the Liverpool situation with the testing that's going on there. I don't know whether you know anything about that. Obviously, it's outside our area, but it is of general interest to certainly everyone, I think, that they're rolling out a mass testing program there. Sharon.
Yeah, so there's 3 pilots going on in the country at the moment around mass testing, and it is the fast turnaround testing called lateral flow. And Liverpool is the city pilot. We have got Bury St Edmunds as a large town pilot, and we've got Redruth as a small town pilot. They will be running for the next couple of weeks as they work through and we get some learning and the accreditation for the fast turnaround testing gets approved. Then there will be a rollout programme across all cities and towns. We don't know where we sit in there. As Lucy said, we have put some interest in to see if we can be part of some of those pilots. And looking to see how we could utilise it in some of our harder to reach areas. But it will be good news because people will know very, very quickly of whether they're positive or negative. So it is good news. They are utilising the military to help roll that out. So again, that is another good news story. So as soon as we know when the rollout for that is going to be happening more locally, I can update the group on that.
Thank you, Sharon. And I know it's not specific to Northamptonshire, but I think it's very useful information to have showing. Well, I use the word light at the end of the tunnel for some people, I would imagine, in terms of testing and things like that. So it's very good to know that. I'm going to move on to contract tracing update, which brings us back to Lucy again. Again, this is a key weapon in our arsenal for defeating this virus locally and nationally, I would imagine, but certainly locally. Lucy.
It does. I'm just trying to share my screen. I'm hoping that people can see this. So this is the current position from a point of view of our contact tracing. So what we've tried to do here is pull together both the national and the local outcomes. So people will remember my narrative that we took on local contact tracing because we were actually the most poorly performing area in Northamptonshire through the national team. So we decided that we needed to improve that position in the East Midlands, that is, and therefore quite early on in the process, in fact, with the second area in the East Midlands to undertake the local contact tracing. Since that go live point at the 15th of August, where the contact tracing through the national team was at 69%, we're now managing to follow up 83% of the cases that come through to us. So I'm sure people people will agree that's a significant improvement, and people can obviously see that we're sort of managing to maintain or improve our position week on week, which again is a really important point. We don't want this to fluctuate, but this needs to be a key component, as you say, Councillor Morris, of our ability to identify where the virus is and obviously isolate those people that may have been exposed so that we can break the chain of transmission. One of the things I do need to say is that this isn't just the team at the council that do this. They work really closely with the boroughs and districts, the EHOs, the community wardens, etc., to then follow up people that we're not able to contact via phone. So it's a primarily phone-based service initially within the council, within the county council, where we can't then make contact. That gets escalated to the boroughs and districts, and they physically visit premises. So, you know, it is a joint effort, and it would only work as successfully as it is at the moment with everybody's buy-in. So I just wanted to take the opportunity to say thank you for that support. This second slide just shows you the number of cases that we're dealing with, and therefore obviously just the sort of the way that we've had to rapidly escalate the capacity within this service over time. Now, this is a reflection of both changes to the national process and therefore us getting a larger proportion of the cases. We get around 30% of the overall cases where the national team hasn't managed to follow them up. But you can see just because of our number of cases has increased over time, we're now dealing with many more referrals. The benefit, again, as I've said before, of also having this local contact tracing process is that when we do contact cases and get their contact details, we're also able to understand where the likely exposure happened for them. So it informs where we understand our risk areas are and our risk settings are. We're able to give much more tailored advice to that case and the consequent contacts that they identify, and that's able to inform our communications and our engagement. So the overall benefit of having this service is not just that we've improved the proportion of cases that we follow up, but we're able to get much richer data that helps inform our strategies. So again, thank you to all of the people in Northamptonshire that are helping us by contacting us, by answering the phone when we call, by telling us who they may have potentially put at risk when they were unaware that they were a case. It's such an important step in us breaking the onward chain of infection, as I've said, and it's just really key to us enabling us to keep our vulnerable residents safe. So thank you, and I encourage those, if they are contacted again, just to engage with us. You know, we don't use this information for anything other than making sure that you and your family and loved ones are safe.
Thank you very much, Lucy. Very good summary of the data there. That definitely has improved, but obviously can improve a bit more with the help of everyone out there. Be lovely to see it in the 90% or above, or even 100%, whether that's possible. I'm sure it's near to that as possible, but we can only do that with the help of the people of Northamptonshire, which you've already pointed out. So I'll just reiterate that. I'm going to move on. Are there any questions? I can't see any hands up, so I will move on to the comms update from Claire Hughes. Hello, Claire.
Hi, good morning. Yes, just very quick, I'll try and keep it brief because we're overrunning. Obviously, our key focus has been on updating the website, digital and social channels with the information and restrictions around lockdown, so that everyone can find that information. We've rejigged our website pages to try and make it a bit clearer, and we've added in some FAQs for local and national information. So hopefully that will be much easier for people to find when they go. Our messaging obviously continues to promote people to test if they feel that they have got the symptoms, even though we're in lockdown. And also we're continuing to promote messages around what to do when you're self-isolating, particularly when you're in shared households. We've got information online through our social media, and we've also delivered leaflets around the county into letterboxes. We've also will be publishing information on accessing help and support if you're extremely clinically vulnerable. There'll be a press release issued today, but more information will be added as that develops over the coming weeks and days. But we've definitely got signposting there for people who want to know more. We've had a good level of response to our Ask Lucy campaign, which we posted on social media asking people if they had any questions for Lucy that they wanted answering. We're now collating that, and we'll be putting her answers online very soon when we've managed to get the camera on her. We've also been having a radio campaign active for 2 weeks, which has been promoting the, well, basically reminding people of all age ranges of how to reduce the risk of transmission by changing the way that they undertake their daily activities. And we are continuing to support the media inquiries through our press interviews and press conference, of which one will be tomorrow again. And then finally, as you'd expect, we're working closely with all of our partners to share messages. We're working closely with the NHS and police on sort of both longer term and short term and current messaging that needs to go out there. And likewise, it's reciprocal sharing. Just to pick up on the issue around testing sites, yes, we have, or will be, I think we have actually removed the information from the website giving the locations of those test sites in an effort to stop people from turning up ad hoc thinking that they can get tests. So please just remind yourselves to go to the portal and book your appointments online there. I think that's the update.
Thank you very much, Claire. Some very important work going on in the comms team, as always, and thank you for all your efforts. I'm looking around the room. I'm not seeing any questions. So I come to future meeting dates. We've got a meeting on the 12th of November at 8:30, the 19th of November at 8:30, and the 26th of November at 8:30. Unless anyone's got any other business, I will close the meeting. Thank you very much for attending, as always. Thank you for the very good reports and the questions that were asked. I'll see you again soon. Stay safe and well.